Alright, what's going on? I am Michael Lee, and we are back for another video. Hopefully, it's gonna be a good one. Um, this is gonna be a streaming one on a video game, and the video game is final. It's full code. Yeah, it's full code, and yeah. So I'm gonna go ahead and get onto it. And it's full code medical simulator. Um, how I came on this one is I was looking for one of them doctor games where you could like play doctor, cause like I had a dentist one where you could play dentist, and I kind of liked that one, and you get to play with the tooth and clean teeth and stuff like that. And I was like, oh, I wonder if they have a doctor one, and so I found this one. So yeah, and I got my own profile on here and everything like that. So yeah, so yeah. So let's go ahead and get into it. I'm gonna go ahead and find a case so we can get go ahead and start. Basically, this how it is. You come on here and you choose a case, and you help make the patient better and stabilize them, and then you either release them or either discharge them or send them to the operating room or put them in like the ICU, or you can like do something like that or put them in the hospital. Um, yeah. When you do this, they got like different levels. They got like a free version. They got like a paid version, and yeah, they got like a unlimited version where they got everything. I ain't want all that because I don't do it like that. Some people like are in the medical industry and they want to where they want to know exactly what they did wrong, what they can improve on, all that kind of stuff. I ain't want all that. I kind of just want the bare minimum, that kind of stuff. So that's kind of how I started. All right, cool. So let's go ahead and find us a case. Okay, so I got one. Let's do this one. It said abdominal pain. Um, so let's do this. It said abdominal pain after like after the transplant. I think that what it said. So it said the patient is walking. 56-year-old male. Liver transplant with RUO, abdominal pain for 1 week, fatigue, fever, tachycardic, and soft BP, and yeah, triage to the back. Okay, so let's go. So maybe a low BP, and they are having some abdominal pain. So I kind of like this game because I've been to the hospital enough and to know what to do because I've been a patient, and so I kind of know what it feels like not to feel well. So I think I can know how to kind of treat a patient. And plus, they have explanations beside the medicines if you don't know what it is. So yeah, let's go ahead and get into it. I won't talk too much about that. So come on. If you want like a review or something like that, or a tutorial, this is not what this is. This is man like a walkthrough during a video game. But okay, let's go. So let's get into it and begin. All right, so looking here, I'm noticing some discoloration of his legs. Like one is darker than the other one. I'm gonna come over here. And so I'm gonna just get into it. So if I don't talk to y'all, I apologize. So let's get into it. So what I'm gonna do is turn on the monitor and get his blood pressure started. So that's what I'm working with. Okay, so that's the blood pressure, 105/75. It's kind of low, so I kind of gotta watch what I give him. Heart rate 112 is a little high. It's not supposed to be over 100 unless you're exercising. The oxygen is fluctuating like between 99 and 100. So what I want to do first is go ahead and I want to put him on oxygen. When I do this game, I like to put my people on oxygen. Nasal cannula first, because I know that's what I would want if I was a patient, kind of to help relax. And then I want to insert an IV. I don't like IVs, but you know it kind of helps because you have to have blood work. All right, now let's get into the blood work. So we know he's having problems with his liver, his stomach. So what do we need to do? We need to do some labs. So let's start with some labs. So C relative, do these urine tox. That one. That one. I want to do the tissue yet. That one. Okay, I can. Oh, I gotta do the back one for that. You gotta do, yeah. Okay, yeah. That one. Blood culture time 2. Pace. Alright. Urinalysis. Troponin. ProBNP. Magnesium. Do I need that? No, I'm gonna hold off on the magnesium for now. This is when I really want liver panel. Lipase, lactate, D-dimer, CBC, congestive coagulation panel, calcium, both of them. I don't need the blood type and screen just yet. Chem 7 and arterial blood gas. And what I like to do just to make sure I'm okay is I like to do a ECG. That's like a bedside something for your heart to make sure your heart is beating in the right. It's a bedside, yeah, for something for your heart. And also, I would like to do, and I'm not a medical professional, by the way, and a finger stick to make sure the glucose is okay. And put that in. I have no clue what that means. Okay. Sinus tachycardia. Okay, which means he has a regular heart rate, but there's something irregular about it. But it's still regular. Alright. And the first thing I look at when it comes to blood work, I look at sodium. Because if the sodium is off, just about everything else is going to be off. 135. Okay, it's okay. Not too bad. So it's kind of like perfect. Bicarbonate. Something's wrong with his breathing. His respiration. It's something in his body is not being produced right. In my opinion. He has a white count. Wow. His liver is just... Oh, wow. Okay, now he is negative for any substance abuse, stuff like that. See, when I do this, when somebody complains about anything abdominal, I like to do top screen to make sure they're okay. I think that it's something, either one, he could be rejecting his liver, or two, he might just be having like something wrong, like gastroenteritis or something like that. Like he might be having a stomach bug, because it's not too bad, because his blood pressure is stable, his heart rate is a little high, and his O2 is good. I just put the Nasocane on just because. That's just me. So, what I want to do next is start by giving him medicine. I can start by giving him medicine. What I want to do is, and I also get like an ultrasound or like a picture of his stomach, but I want to give him some medicine. All right, so go to gastro. No, I don't want gastro, my bad. Go to allergy. Yep, that's what I want. And then I'm going to do Benadryl, because he has a abnormal white count. And white count is how your body is dealing with, meaning like, are you feeling well? Like, are you feeling sick? Like, do you have a cough or fever, congestion, stuff like that? Is your body fighting a sickness? And according to his body is fighting some kind of sickness. It might not be a cough, but it could be in his abdomen or his liver. Something's going on in his body where his body is fighting sickness. So to help with that, I want to put in some Benadryl. So Benadryl to help with that, to help recover. And also, for gastro, I want to do some ondansetron, and that's going to help him with nausea, help him to relax, anything like that. Um, yeah. And with his kind of low blood pressure, you kind of want to be careful what you give him. So it doesn't totally, you know, make it go down low. All right. And before I give him, because I do want to give him fluids, before I give him fluids, what I want to do is do a X-ray or ultrasound of his stomach. So CT abdomen, CT aorta. That's like in between the rest of his like body. That's to make sure no internal bleeding, stuff like that. CT chest. And chest X-ray as well, just to make sure nothing's going wrong funky that he doesn't know about, we doesn't know about. All right, because you ever heard of something called silent but deadly, a silent killer? Yeah, we want to make sure there's nothing going on like that. All right, so let's look at the chest X-ray. Normal lung fluids, no evidence. Okay, so that's cool. No evidence. Okay, normal lungs. And let's look at the aorta. Normal CT scan. Thoracic abdominal. Aorta. Okay. Now let's look at the abdomen. I have no clue. I have no clue that, so I gotta read that more carefully. Status post orthopedic liver transplantation. The visualized solid organs, vasculature, and soft tissues or otherwise normal. Okay, so it's just saying that he had a liver transplant and everything else is normal. Okay. Now, what I want to do now is give him some fluids. So fluids, and I'll consult with a gastro and see what they want to do. I want to start off with normal saline solution, 1 liter, because I don't want to flood him and cause something with his heart. So 1 liter. See, went down just a little bit. Yeah, 102. So we go now. All right, and his blood pressure kind of went up slightly to 110. All right, now what I want to do is consult gastro and see what they want to do. Okay, so they want me to consult the transplant surgery team. right. All right, so what I want to do is after we have all the tests, we have to come up with a diagnosis. All right, so I need to look at his blood work. All right, because I can't really keep him in the hospital because he's good to go. I mean, all right, cool. It's just his white count's up. So, what I want to do is give him some medicine. Give him some aspirin for his heart just to make sure. And I want to give him some antibiotics. Amoxicillin. Alright. Cool. Now, let me see, because I think... let me go back up here. Cause I think I'm about through now. We can about get up out of here. But let me do a Tish. Alright, so I think that's what I'm gonna do. I think I'm gonna just count it up as a stomach infection and finna just let him go because I can't just put him in the hospital just because of elevated white count. Alright? And I gave him some fluids. I thought it was gonna let me check his white count again, but it wouldn't let me do it. Had let me did it once before, but not now. So, that's what I'm gonna do. Alright. Go open the gastrointestinal and do acute gastritis and discharge. And if it's wrong, it's just wrong. But that's what I would do as a person. Because think about it. His blood pressure is good. Alright. his oxygen is good. I mean, I put on nasal cannons, but it was still 99 when I did that. Saturation is good. Everything is good. The only thing is a little off is his heart rate, which is like 101, 103, and that's not bad. Or it would be worse. You know, he'll be complaining. Like it will be more rapid on the yeah, it'll be more rapid on the screen. It'll be way more worse, and his oxygen will be more less if it was more dangerous. So that's why I'm letting him go. And if he has any more problems, he can just come back. But we can't do anything right now. It's not as bad as it needs to be. Yeah, it has to run its course. So I've heard that before. So let that go. And so acute gastritis, which means there's something going on in his stomach. And if it was a liver problem, what we would see is a bleed in his liver. And we would, yeah. And we would see like his blood level would be low, and his blood level is not low. So both his white blood cell and red blood cell count will be off. But just his white blood cell count is off, which means he has an infection. I gave him medicine for that infection. So let's see. And if it's not, then it's just not. And I'm not going to spoil it for y'all. So you got to do it yourself. See? I treated him right. So it said overall score 28.3%. So we was both wrong on both accounts, but it is what it is. At least we treated him the right way. So thank you all, and make sure y'all download this, comment, rate, and subscribe. And that's about it. Yeah.